Afternoon.
Hi, Sanya. I'm doing good. How are you?
All great. Thank you for joining us even when you are not well, and especially on a Sunday. We'll just
Thanks.
wait for 5 minutes. We'll wait for people to join in. I think we already have 5 people that have joined in. That's great.
All right, all right.
So, to our attendees, just want to know after this webinar is done, you will get a custom link through which you can book a free consultation with Dr. Afshan. And you can get in touch with her, meet her, and ask all your questions as well, apart from the webinar.
Right.
So are you getting a lot of patients coming in because they're not feeling well because of the weather change, doctor?
Oh, yes. Viral is on the rise. In fact, every second person is
Wow.
down with viral, including me right now.
Oh, yeah, yeah.
It's
I
very
feel you. Sorry,
airborne,
sorry.
easily you
Mhm.
can breathe in the virus, and the entire
Mhm.
family is coming with the viral.
Mhm. Mhm.
Definitely, it's on the
I
rise.
think this must be a regular thing in Bangalore. I'm sure a lot of people are catching something or the
Right.
other because of
Right.
the
But this time
pollution.
it's a huge surge this time. We generally don't see so many cases. This time it's a
Mhm.
instead of dengue, we have got this viral influenza which is
Oh,
on the rise.
oh, okay. So dengue is also on, right? We should start putting our Odomos and everything.
Right, right. But we have not got many this time
Okay.
compared to these respiratory cases.
Okay. Okay, that's good to know, I guess. I was also very sick with a viral the last, I think, 2 weeks ago, and it was really bad. Usually, I wouldn't get as badly sick, but this time the viral really got to me.
Yes,
So
it drains you out
I
completely.
can sympathize with the people who are suffering now. I
True.
went to office and I was sent back. But you go home, you're not feeling well.
Right.
Yeah. You will just wait for 3, 4 more minutes. We'll have more people join us.
Okay.
Office and I was sent back. You're not
पानी लो। तेरे लो, तुम ले लो।
Hi, everybody. Hello to everyone joining in. We'll just be starting in another 2, 3 minutes. We're waiting for people to join in.
Let it be.
Okay, I think we'll start now. We shouldn't wait any longer. Sunday after all.
Okay.
Good afternoon, everybody. Thank you so much for joining us. We have a very interesting webinar lined up for today, which is, I'm sure, is something everybody's so curious about. It's a lifelong struggle. I've also struggled with weight loss all my life, and I'm sure everyone's heard so much about, the weight loss drugs going on, and I'm sure everyone has a lot of questions. So this is our cue. Weight loss feels like a lifelong struggle for a lot. People struggle with diets. There are gyms, there are endless crash diets. It doesn't end. I think it's a whole industry, but I feel like the results often don't match the effort people put in. And personally, I've also struggled with it so much. I realize sometimes people aren't always doing the right thing. So today we have Dr. Afshan, who's going to help us, separate myth from fact and help us understand the science behind weight loss and explore some modern treatment options that have worked for some of medicine's patients as well. So thank you, Dr. Afshan, for being here and joining us. She's a consultant physician who has extensive experience in treating obesity with a holistic approach, combining medical treatment, lifestyle planning, and long-term patient support. She has worked with patients across different BMI categories, helping them find sustainable solutions, whether it's through lifestyle changes, medications like GLP-1, and everything else in between. Thank you so much for being here, doctor.
Hi, Sanya. Thank you so much for having me here.
Okay, so I think let's just get into it straight. I really want to ask you, why does weight loss seem so difficult? Why is it such a lifelong struggle?
Right. So people want to do a diet, a gym routine in the efforts to bring about weight loss, but the major setback that is happening is they set the unrealistic goals. People here nowadays want a major weight loss within a short period of time. They go ahead and do a poor planning. They have no knowledge about the weight loss. There is lack of flexibility, lack of enjoyment in the process of weight loss, and there are so many conditions, health conditions, which are not taken into consideration when they go ahead for the weight loss. Like for example, people may have thyroid issues, PCOD, who are struggling with weight gain, but the underlying health issues need to be taken into consideration, not just the weight loss parameters. Eventually there are certain people who end up doing emotional eating, there is stress eating, anxiety eating, which can contribute to weight gain, which is not considered in these diet and gym routine plans. There are certain people who are really busy with their lifestyle. They are not able to give time enough time for these weight loss regimens, and that is why ultimately these regimens fail.
Hmm. I think a lot of people will be able to relate to what you said. I think people struggle a lot with, making time, and then I think making the right choices of food.
Right.
Sometimes you do want a sweet little treat after dinner or
Right.
after hours.
And it's very
So,
difficult to resist the cravings also. During the process they need to
definitely,
have a lot of resistance, which is not easy for
definitely.
everyone.
Definitely. I mean, that's completely true. But also, doctor, I have another question. So, there's something called BMI, and there's so much information around it. Could you
Right.
help us understand what BMI is and how does it matter in my weight loss journey?
So, Sania, BMI is nothing but body mass index. It's basically a screening tool. It is a formula that we use to categorize people into various categories. The formula being weight in kg, which we divide with height in meter the whole square. So, this BMI will give us an indicator of the measure of the body fat of a person. Though it does not include the muscle mass and the other parameters, but definitely it can be used as a screening tool to so that we can know which patients are at a risk of developing complications, who are in the overweight category, who are in the obesity category. So it's very important to identify such individuals, and that is why BMI plays a very important role. At the same time, as and when we track the BMI, we are able to understand whether the weight loss regimen is working. So the progression of the weight loss we can be able to track with BMI. So if I have to tell you the BMI categories, there are various categories of BMI starting from 18.5 to 24.9, which is a normal BMI. 25 to 30 is a BMI of overweight. Beyond 30, we say it's obesity. Now, again, obesity is divided into three classes. 30 to 35 is obesity class 1, 35 to 40 is class 2, and beyond 40 is class 3, which is a morbid obesity. So, as and when the BMI increases, the health risk associated increases, and we will be able to pick up such individuals which are ideal candidates for weight loss.
Hmm. Okay, so you're saying higher BMI means bigger problems and more of an urgency to lose weight and get healthier.
Right, right.
Okay. So, can you tell me what are some key health risks associated with having a higher BMI?
See, the higher the BMI goes, the risks associated will also increase. So, if I have to name a few, the list goes on and on. But the few to name will be diabetes mellitus. People will be in the pre diabetic range if they have a high BMI. They may end up having type 2 diabetes mellitus. They may be increased cholesterol levels, which is called medically as dyslipidemia. They may end up in a lot of complications like heart related issues, heart attack, stroke, coronary artery disease, ischemic heart disease. Osteoarthritis is a major concern nowadays because of the increase in the weight. And then there are various cancers that we come across due to this overweight and weight gain, which is like esophageal cancer, colon cancer. They are at a risk of developing these, comorbid conditions. And nowadays, obstructive sleep apnea is on the rise. It's again due to obesity, where they are not able to breathe easily, and it's becoming a very big harm to the patients nowadays. So these are just to name a few, but the list goes on and on.
Okay, so being obese has a host of problems, from not being able to breathe properly to also developing some cancers. So would you
Definitely.
say being obese and being overweight is one of the worst, you know, conditions to be in? Is it that big of a problem? Because I know there's so many people who, think their weight is not that big of an issue.
Right, because as and when they will not be able to judge whether they are overweight, whether they are obese, whether they really have these conditions go undiagnosed. And that is
Hmm.
the importance when we as doctors and medical experts try to assess them, we pick up these diseases. Obstructive
Hmm.
sleep apnea is a disease which goes undiagnosed. Many people out there will be snoring loudly. That's a major
Hmm.
sign of obstructive sleep apnea. So a lot of
Hmm.
these diseases, they will not know that they have it.
Hmm.
Even
Hmm.
nowadays, youngsters having MI, heart attack, it's all unknown, undetected. So the more you detect, the right time of diagnosis is important nowadays.
Hmm. Okay, so now we know about BMIs, and we know that higher BMIs mean, big problems for people that have a higher BMI. So,
Right.
what are some treatment options that differ across these categories?
Right. So if I have to tell you the categories, 18.5 to 24.9, as I told you, is the normal BMI. Once the people are in the range of 25 to 30, that is people who are overweight, we have a lot of treatment options open to such people, such as exercise, dietary, lifestyle modifications. We definitely tell them to take a increased protein diet, low fat diet. We try to make them, explain them the importance of exercise, at least brisk walking. At the same time, we have certain GLP-1 drugs, which is the talk of the day today, which can be considered in people who are overweight, especially a BMI of 27 and above. People who have got a lot of complications due to the overweight parameters, like people have
Hmm.
fallen in depression due to this, they have their own confidence issues. So, such people
Hmm.
can be considered with GLP-1 drugs as well.
Hmm.
There are also
Hmm.
fat blocking drugs nowadays, such as orlistat, which is being used frequently. That will
Hmm.
also be one of the options for people who are in
Hmm.
the overweight range. Now,
Hmm.
once we start the increasing the BMI, 30 to 35 is obesity class 1. The treatment
Hmm.
options will be more or less the same, where GLP-1 drugs will also have an upper hand. There will be exercise, diet, lifestyle change, fat blocking drugs with GLP-1 drugs. And
Hmm.
once the BMI goes beyond 35, the
Hmm.
new option that comes in will be the bariatric surgery,
Hmm.
the gastric sleeve surgery. So these surgeries will be an option which will be given to the patients if they have a BMI of 35 and above or 40 and
Okay.
above with very bad complications or major complications that they're suffering from.
Okay.
So
Okay.
this is how the
So,
treatment is.
okay. So, sorry to go off track here, but I have a very important question that I'm sure our audience also has. Is liposuction a weight loss treatment?
Right. So liposuction, this I've got a lot of questions nowadays that we want to go for liposuction. This is definitely not a weight loss treatment. If I have to explain you what it is, it's just a simple surgical procedure. I can say it's a cosmetic procedure, and the other name for this is lipoplasty. Or in simple words, a body contouring procedure. So liposuction, what it does is it removes the excess of subcutaneous fat which is deposited in certain areas of the body, such
Hmm.
as people will be affected with certain areas like hip, thigh, abdominal fat. So they are interested to take out the fat only from those areas of the body. So overall, for a cosmetic benefit. So that is
Hmm.
what liposuction does. It's definitely not a weight loss procedure, nor is it
Okay.
related to obesity.
Okay. So, liposuction is a body contouring cosmetic procedure.
Yes.
There's someone asking in chat if we get the recording. Yes, so you will be getting the recording. It'll be uploaded on our YouTube channel. Okay. I now want to move on to something that I'm sure everyone's curious about is about this magic drug that's going to change everyone's life. Please, please, please tell me about GLP-1 drugs and why are they exactly called magic drugs and how does this magic work?
Right. So if I have to tell you, start off with GLP itself, it stands for glucagon-like peptide. Now, these are hormones which are naturally released in our body when we consume food, right? So once we eat something, our stomach and intestine will release these hormones, which will send signals to the brain, and it will indicate the brain that, okay, we have food in our tummy. Now it's time to stop eating or reduce your eating. So
Hmm.
this particular action of this hormone is being used by these GLP-1 drugs. They mimic the same hormone, and in this way they are going to reduce your appetite. They are not going to make you eat more, so your hunger will be less, your appetite will be reduced, and you will not end up eating too much. And that's a major reason why GLP-1 drugs have brought about weight loss. Now if I have to tell you the added benefits of these drugs, why they are really the magic drug, is because they also enhance insulin sensitivity. They bring
Hmm.
about insulin secretion, which is directly acting on the blood sugar levels. Your blood sugars are not going to increase or decrease. It will not fluctuate frequently, especially diabetics who have ended up with weight gain. Those people have got the maximum result with GLP-1 drugs because their sugars are
Hmm.
definitely not going to spike up. So this
Hmm.
is how these magic drugs are going to act. So in
Hmm.
simple words, these drugs will make you feel more full, less hungry. They will
Hmm.
reduce the gastric emptying. That is, the stomach will, the food will stay in the stomach for a long time so that you don't feel hungry again and again.
Hmm.
So this is how these drugs act.
Okay. Okay. So they sound amazing to me, but I'm curious, considering it's a new drug, is it safe? And does it have any side effects that, people taking this treatment should be aware of?
Right. So GLP-1 drugs are definitely safe and effective. It has given considerable weight loss results in diabetic patients, obesity, people who have been suffering with the obesity. They have got very good results with this drug, but definitely there are side effects with it. So the commonest side effects that we come across when we put you on GLP-1 can be ranging from nausea to
Hmm.
vomiting to loose motions to constipation. These are the commonest side effects that we come across. But there are definitely more serious and less common side effects also, which we need to be watchful of throughout the process, and which includes pancreatitis, certain thyroid malignancies, gallbladder stones, and bowel obstruction, gastroparesis, thyroid related dysfunction. So, all these are less common, rarer effects, but are serious side effects which we need to be watchful of when we put a person on GLP-1 drug.
Okay. Okay. So it does have a few side effects, but the ones that you mentioned are rare.
Rare.
Okay. Okay. So we've spoken about side effects, we've spoken about how the drug works. Now I'm wondering who is the best candidate to take up this treatment?
So, people who have been suffering from overweight, obesity, who are already having diabetes and other comorbid conditions associated with obesity, like obstructive sleep apnea that I mentioned earlier, osteoarthritis, who have been suffering with dyslipidemia, stroke, heart risk, all these patients are the ideal candidates for a GLP-1 drug because it's not only going to bring about weight loss, but it's also going to enhance your cardiac protection, renal functions, and blood sugar levels, and definitely overall it will show a healthy benefit to every
Hmm.
individual. And if you have to ask me who's not the right candidate for these
Hmm.
drugs,
Hmm.
definitely we do not want to give this drug to anyone who's pregnant or planning
Hmm.
pregnancy in the next 2 3 months, who's breastfeeding, or people who are type 1 diabetic. We do not get much of results with these drugs. So type 2
Okay.
diabetes, definitely it has given very good results. And people who
Okay.
have already had a history of pancreatitis, we do not want to give this drug because pancreatitis,
Hmm.
as I told you, is one of the rarer side effects, and people who
Hmm.
already have it are at an increased risk. So these are
Hmm.
few people whom we do not want to give the drug.
Okay. So it's not a one size fits all sort of treatment, but it can be tailored to each person's health profile.
Definitely, definitely.
Okay. So I'm also curious now that we've spoken about how this treatment can be tailored, what are some tests that maybe, we do to ensure that this is the best candidate for this treatment?
Right. So I generally prefer to do a basic blood test so that I'm sure that the patient is an ideal candidate for GLP-1. That involves a few tests, such as, to name a few, complete hemogram, lipid
Hmm.
profile, which will be done in the fasting, thyroid profile, certain pancreatic enzymes like lipase, amylase, not much, and calcium levels. And in the lipid profile, I want to see the triglyceride levels, the bad cholesterol, the good cholesterol levels. At the same time, the sugar monitoring, HbA1c, fasting blood sugar, postprandial blood sugar, these are some of the basic tests in addition to the liver function test and kidney function test that I would want to do so that I'm
Hmm.
sure that the person is safely going to be put on GLP-1 drug and they do not end up in these side effects which I have already mentioned.
Hmm. Hmm. Okay, just so we let our attendees know, we will have a live Q&A session with the doctor. So please stay tuned after we our discussion is done. And also you will also be getting a custom link where you can book a free consultation with Dr. Afshan. And she will also be kind enough to take online consultations for those who will not be able to make the trip.
Right.
Moving on, I really want to ask you. So I started GLP-1 drugs. I've lost the weight. I'm feeling great. But is there any way that the weight, stays off?
Hmm.
Because I think everyone struggles with this. They lose the weight and then they'll gain it again, and they'll lose it and then gain it. It's like a cycle. So does that cycle end with this magic drug?
So, if I have to tell you, you are asking me basically how do we maintain a healthy weight loss and how do we maintain our weight in that once we achieve
Yeah,
it.
is it a possibility? Like if I take these drugs, then I will not gain the weight back? Because I think that's the motive. People don't want to go back to their unhealthy weight.
Definitely, definitely. See, these drugs are going to help you achieve your target weight that you are desiring from years. Once we have achieved your target weight and once we put you off the drug, there are various other regimens that you need to follow so that your weight is persistently in that same range. So, if I have to tell you what is a healthy weight loss is something ranging from half kg to 1 kg a week. So, beyond that, we do not warrant a weight loss beyond that level. Another thing is how do you maintain this weight? You have to make sure that you take a balanced, low calorie diet rich in proteins, fibers, vegetables. Hydration is very important. You need to keep drinking as much as water as you can. ORS electrol is very important part of the diet. You have to practice mindful eating. You have to make sure that you limit unhealthy foods. And coming to the exercise part, cardio, strength training exercises, muscle strengthening exercises needs to be done, and I advise at least 150 minutes of brisk walking or swimming at least for 2 days a week. So these are the minimum that are things that we expect you to do so that you don't put on your weight back once you are off the drug. And another
Hmm.
important thing is please set realistic goals. Do not set unrealistic goals which are difficult to attain. Right?
Hmm.
You have to
Hmm.
make sure that you have a good sleep, you track your progress of weight gain or weight loss, and you have to get in touch with the consultant at the earliest
Hmm.
as and when you get any concerns.
Hmm. Okay. So even after you're done taking the drug, you still need to take care of your lifestyle. You still need to take care
Definitely.
of yourself. That doesn't change at all. But
Definitely.
doctor, that makes me wonder. I have to take care of myself with or without the drug, right? So
Hmm,
what is the difference then? Why should I choose, say, a doctor-led program
hmm.
versus maybe going on to the chemist and getting, self-medicated? What's the difference there for people who might be curious?
Right. See, if you go for a doctor-led weight loss program, you will have a doctor consultation, a health expert, a medical expert who will be guiding you throughout the process. It will be a safer, more effective way. It will be a personalized plan, which will be individualized from person to person. Now, every person is not the same. You may be having certain issues which other people do not have, like thyroid, PCOD, which I've already mentioned. All those medical parameters will be taken into consideration when you get in touch with the doctor. At the
Hmm.
same time, you will have a safe access to the right medicine in the right dosage. There are people who self-medicate with the medication, but they may either underdose themselves, overdose themselves. They may not know how to dose themselves. The route of administration is important. So these are all parameters which only a medical expert can help you with. If you try to
Hmm.
self-medicate, there are various drug interactions you may not be aware of. You may be underdiagnosed with certain conditions or overdiagnosed or misdiagnosed. So these are all rare risk factors which are involved if you go ahead for self medication. I would always want you to go for a doctor led weight loss program where you will be under constant supervision by the doctor.
Hmm. So, having discussed all of this, I'm wondering what does recovery typically look like? Is it that if I'm taking the drug and if I go off it, will I experience any withdrawal symptoms, or is how does my recovery look like after this treatment?
So definitely, once we take you off this GLP-1 medication, it may go on for 3 months, 6 months based on your target weight. Once we achieve the target weight, we slowly taper the medicine and we try to wean you off the medicine completely. Now, once you have got your target weight, you will feel more healthy. You will feel more confident about yourself. You will feel like having more social interactions. Social activity will increase. At the same time, there will be a positive impact on your lifestyle, and you will feel that you are more healthy compared to before. You will have decreased appetite. You don't have to battle your cravings anymore. Overall, it leaves a very positive impact on your life once you achieve your target weight.
So, have you noticed with your patients who've taken the treatment? who maybe come back with a lot more self-confidence, apart from the fact that they've lost weight, but also, being able to control their cravings and take better decisions. Because I feel like a lot of people that struggle with their weight, their biggest problem is that they're not able to make good decisions for themselves.
Right, right. The major reason why they don't end up in having a weight loss is because of the cravings. They have their own body dysmorphic features that will, drive them more underconfident. They do not want to get into the social activity. They feel very underconfident about themselves. So these are the drugs which will give them good results, and they will be more confident about themselves. In fact, I have one patient who was in depression due to this, and she has now gotten very good results. She's back to her daily lifestyle. So definitely overweight obesity affects everyone in different ways.
Hmm. So I'm curious, doctor, what point do you think a patient should then consider, okay, I think it's time for me to visit my doctor and see if I need this treatment? Like, apart from the candidate, features you mentioned, what point in their journey is when they should reach out to you?
For the weight loss, you mean to
Yes.
ask?
Yes.
So, people, as I told you, there are criteria for these drugs. It's not a blanket treatment where we give it to everyone. Definitely, initially, the people who have turned up to me are those who have not got good results with weight loss regimen, be it diet, be it gym, be it various weight loss online protocols that they have followed. They have not got the results. So, if you are definitely struggling from weight gain or obesity and you're not able to get over these issues, you have to definitely consult me or any medical expert that is from the Medfin, and then we will be the ones to decide whether you really need the GLP-1 drug or whether you can only be tried with diet and lifestyle and the fat blocking drugs. It's all varies from person to person.
Okay. And so you mentioned Medfin. So how is Medfin ensuring that patients are maybe not bouncing back after their treatment?
Right. So Medfin is one team which has dedicatedly worked towards finding patients who are in genuine need of these drugs, because obesity and overweight is a sensitive matter where it's not accessible to everyone. The people tend to keep it to themselves and end up developing a lot of complications. That is where Medfin has played a wonderful role. It has made sure that the patient is connected to the doctor directly. There are online consultations, teleconsultations, regular follow ups of the patients with the doctor. In fact, there are also dietitians and nutritionists with the Medfin team who will consult the patient regularly. There will be a constant supervision from the Medfin team, and they'll address each and every concern of the patient, which is of necessity, because nowadays the patients require the trust. Once they get the trust, they will be able to achieve a better result. So definitely, Medfin has done a great work and has made sure that they don't get back their weight back to the original, and they
Original.
get very good weight loss.
It's very reassuring to hear that a program like this exists, which can, take the patient's worry as their own and take forward the treatment and can really help. I would love to open the floor to some questions. So we've covered majorly all questions that we wanted to cover in this webinar, but we're getting some great questions in the chat. Ms. Dipali says, if I want to lose 30 plus kgs, will GLP drugs help or should she go for bariatric surgery?
30 plus kg of weight. So
Yes.
definitely we need to know what is the BMI. Bariatric, as I told you, goes in for patients who have a BMI of 35 to 40 and who have had lot of complications. Definitely bariatric surgery is a very good option for such patients. 30 kg plus, if is advised medically for the patient to lose the weight, bariatric surgery is one of the good options.
Okay. And Manasa is asking, are the results permanent?
Yes, so this is one question which has been frequently asked. Okay, what happens once we stop the drug? So once a GLP-1 is stopped, there is a chance that you will regain your weight only if you do not stick to your diet and exercise and lifestyle changes. So one of the reasons why we have got a rebound weight gain is when this drug is suddenly stopped. So the drug should not be stopped suddenly. These drugs have to be tapered. The dosages will be reduced over time, and then we will be stopping it for good. Now, once we stop the drug, there will be a dietitian who will be in constant touch with you. The medical expert will be in touch with you, and we will be guiding you ways as to maintain the same weight. You cannot gain back the weight until unless you end up eating, giving into your cravings, or giving into your hunger. So as long you maintain your healthy diet, you are not going to put on the weight until unless you have those cravings, right? So it's all in your hands to maintain the target weight, is what I tell my patients. We have
I'm curious,
got you your target weight. Now it's your duty to maintain it to that level.
I'm curious, doctor, have you seen a patient where maybe they've started the treatment and they've lost the weight, but then they've gained it again? and maybe they've come to you again with the hopes of starting the treatment again. Is that something that happens? And is it medically, advised?
Definitely, we can. There are certain cases where they have not been able to get over their cravings, and people have got a weight gain, rebound weight gain, which
Hmm.
is even more dangerous and even more than the previous baseline weight.
Oh,
Such
okay.
patients, definitely, we want to restart the medication. There is no harm in restarting it and letting them get the target weight achieved. And if this is happening frequent times, then bariatric surgery is another option that we consider, provided the weight is really beyond the BMI of 35 to 40, or they have
Okay.
got a lot of complications. So then
Hmm.
bariatric is also one of the options we start considering, but we can definitely repeat the treatment.
Okay. We have another question coming in, and someone's asking, do GLP-1 drugs help reduce belly fat only or specific fat, or do they help overall weight?
So GLP-1 medicines are going to reduce the weight proportionately, that the entire body, wherever your fat is deposited, it's going to bring down the fat. Not just the target will be belly fat or the thigh fat, it's going to reduce the overall weight.
Okay. And I'm also curious, you mentioned that GLP-1 drugs have a lot of pros to them as well. I'm curious, do they help fatty liver disease? Because I think this is something that a lot of people do get if, they're living a very unhealthy lifestyle.
Right. So fatty liver is a very common disease. In fact, I've picked up many fatty liver patients who have got a lot of cholesterol, dyslipidemia. They do have fatty liver as a part and parcel of this. So fatty liver, GLP-1 drugs have shown very good effects on this such patients. It has in fact improved the fatty liver. It has prevented the progression of this fatty liver to subsequent stages. We have major other stages that fatty liver can progress into, such as fibrosis, hepatitis, cirrhosis, malignancy. But GLP-1 drugs have shown benefit in such cases where they have not, they have halted the progression of the fibrosis, and the fatty liver has also been reversed in few, because it
Oh,
helps in the metabolism of the fat. It prevents deposition of the fat on the liver.
mhm.
Definitely, GLP-1 drugs have shown benefit.
Hmm. Okay, we're getting another question from Dipali. She says her BMI is 39, and then she also follows up by asking, does this reduce just fat or muscle as well?
So yeah, now this is very important question, that these drugs will bring about weight loss. And as I told you, BMI is one parameter which doesn't take into consideration the lean muscle mass it or the body fat. So our body is made up of muscle, at the same time fat. Now the process of the GLP-1 drugs are going to bring about weight loss. They may also attack on the muscles and bring about muscle loss. So that is where the nutrition and dietitian role is very important, and we give you a diet chart which you need to strictly follow, which will compose of lot of proteins, lean proteins, pulses, high fiber diet. The only purpose of this is so that the muscle is maintained intact and you don't lose out on your muscle mass. The more you
Hmm.
eat the protein, the better the muscle will stay. Otherwise, the muscles definitely can also be lost in the process. That is
Hmm.
where the even the aerobic exercises that we prescribe are important. Even the bone health is very important, because this is a weight loss, and the
Hmm.
drug will not know whether it's going to attack the muscle or the fat. So you have to make sure that you are doing good exercise and eating healthy food, so that these are spared.
Hmm. Okay, so even while you're on the treatment, you have to be very careful about your exercise and what you're eating and your overall lifestyle.
Definitely.
Okay, we're getting a few more questions. I think our audience is all warmed up. We're being asked, can GLP-1 drugs increase insulin resistance after withdrawal?
I
Doctor, I think
cannot.
your video is not visible.
Okay. Hello.
Hanji, yes. Well,
Am I
you're audible.
audible?
We can't see you. Yeah.
Oh,
I
is
think you
it?
might have switched off the camera.
Okay. Am I audible? I
Yeah,
think that.
you're audible, but
Okay.
can't see
Okay.
you.
Okay. I'll just work on that. Yeah, you can continue meanwhile.
Okay, so we're being asked, can GLP-1 drugs increase insulin resistance after withdrawal?
So GLP-1 drugs are helpful for insulin resistance. Definitely, it increases the insulin sensitivity and decreases the resistance. And this is one of the reasons why it has also improved PCOD patients who have been suffering with PCOD and infertility. There is a lot of insulin resistance in such patients, and GLP-1 drugs have found a benefit in such patients. It has reduced the insulin resistance and made it more sensitive. And it stays. It is not going to be withdrawn with the drug.
Okay. Okay. Is it possible will we be able to see you, doctor?
I'm trying to. Is it? Yeah. Am I visible?
No, can't see you.
Okay. कर रही हूँ. Am I visible?
No.
I
Should
think.
we try it? Doctor, maybe you can try rejoining with the same link that I've shared with you.
Yeah, I'll do that.
Yeah.
Because I can see myself. I don't think you are
No,
able
we
to.
can't see you. You're not
But
visible on
I'll
the link.
rejoin. I'll rejoin.
Yeah. Okay, till the doctor joins again, please keep asking your questions. We're having a great conversation around GLP-1 drugs. Dr. Afshan has mentioned how the treatment works, how it's helpful. She's joined in again. Yeah, hi, we can see you now. Great. Yeah, hi.
Yeah.
Okay, so we're getting another question. Someone's asking, are the side effects permanent? And if not, how long does it take for the side effects to disappear?
Yeah, so side effects that can be expected is nausea, vomiting, loose motions, constipation, and these side effects are not permanent, definitely not permanent. In the initial 1 month, you will be able to see the results and you will be able to make sure, notice the side effects are withering off with time. So it generally stays for few patients, it has stayed for 2 days, for few, it stayed for a week, for few, it has stayed for a month. But as and when we increase the dose and we go ahead in the treatment plan, the side effects will reduce. It's not
Okay,
going
so
to.
I hope that has answered your question left with Euro. The side effects will phase out. We've got another question. They're saying, Dr. Achan, can you share a few known references who opted for this treatment and are the results visible?
Can you repeat it?
They're asking, can you share a few known references who've opted for the weight loss treatment and are the results visible? I think a lot of
Sure.
people in popular culture might have used this treatment.
Right.
Don't
A lot
know
of
who you
celebrities also. If I
We
have to.
don't know really if we can talk about them directly, but I'm sure Dr. Afshan has a few successful patient stories that she can share.
Definitely. I'll be putting it up in the once you post it on the YouTube, I can definitely share the references.
Okay, but I'm curious, what is the best result that you've seen one of your patients have with
See,
respect to
one of
weight
the
loss?
patients, his baseline weight was 135 kg, and he was on Mounjaro. Maybe it was 5 mg. Then he went on 7.5 mg, and right now his weight is 93 kg, and
Oh,
it's
wow. So
Mounjaro.
it was,
Yeah, 95 if I'm not wrong.
so how
So
many kgs did they drop about?
so,
It is
but the catch is from 135, he got back to 125 with diet. From
Mhm.
125 with Munjaro, he could get to 95. So he has lost nearly 25, 30 kgs. And it's taken
Wow.
time. Definitely, it's taken time and little side effects here and there. But he's now going good with it. We are planning to taper off the medicine for him as well.
Wow,
So
I'm curious, how long did it take him to lose all this weight? And also another additional question I'm sure the audience has is how long does this treatment last for people?
right. So, if I have to tell you about the duration, depends on the target weights that we are looking for. If the target weight is a very small weight to achieve, then the duration is a minimum of 3 months is definitely the treatment duration that we require. If the target is a long target, like in this patient's case, then 6 months is the minimum that I would be expecting.
Hmm.
And the moment we get the weight loss, the target weight loss we are able to achieve, we slowly start tapering the dosage over time, and
Okay.
once we taper the dosage and we stop the medicine, then definitely the patient will see better results.
Okay,
So
we're
the
getting
duration
another
will go up to 6 months, 8 months, depends
okay.
on person to person.
Okay. We're getting another question. Mr. Saurav is asking when can they expect results after treatment starts?
So once we start a GLP-1 drug for you, the results will be visible by the end of 1 month. You can expect at least 3 to 4% of weight loss, at least being the basic minimum. And few people have ended up losing more weight. Few
Hmm.
people have ended up losing little less weight, but by the end of 1 month, you will be able to appreciate the results.
Oh, okay. And okay, that sounds amazing. I think within a month to see some results is very encouraging for people to continue on the treatment journey. But
Right.
I'm getting another question via my personal DM. Someone's asking if they're already on diabetes medication, can they still take GLP-1 drug? or
Definitely. So, people who have diabetes, especially type 2 diabetes, as I mentioned earlier, GLP-1 drugs do wonders for such patients because it's not only going to target your weight, at the same time, it's going to make sure that your sugar levels are very much under control. So, people
Mm,
who have diabetes are on a set of medications. We try to reduce those medications because the GLP-1 drugs will do their job and they are going to reduce the sugars also for you. So,
mm.
definitely, little titration of the medicines, little close monitoring of the sugars is needed in the initial period, and over the time you will get better results of sugar control.
Okay, and so talking about sugar control, do GLP-1 drugs also help with the cravings for alcohol and smoking?
Definitely. In fact, GLP-1 drugs have shown benefit. They act on the receptors in the brain,
Hmm.
and the brain has certain reward centers which are,
Hmm.
involved in these addiction behaviors. So the more
Hmm.
you smoke, you get the rewarding feeling, and you end up smoking more. So
Hmm.
GLP-1 drugs have known to have act on this receptors, these reward centers, and it has suppressed the cravings for these. So overall, it
Hmm.
has also made sure that you don't succumb to alcohol and smoking during the process of GLP-1.
Hmm. Okay, so a lot of positives with this. So alongside weight, there's cravings, there's positive effect on liver. There's an overall, it's a holistic medication, a holistic treatment, if
Right.
I should say. Okay, I think we have a few other questions. So I've heard about GLP-1 injection, and there's also pills. So is there a difference in those with respect to efficacy and who can take what?
Right. So GLP-1 drugs are available as injections and oral pills. Oral pills we have is Ribelsis, which is a semaglutide. And if you have to ask me which is better, I would prefer an injection above oral. Oral tablets, there is no harm in taking. Side effects remain the same, but it takes a longer time to achieve results
Hmm.
when it comes to
Hmm.
weight loss. So oral pills will give better sugar control, but
Hmm.
weight loss, it will be taking a lot of time to achieve your target weight loss. But with
Hmm.
injections, we get better results with weight loss within a shorter period of time
Hmm.
comparably to the oral drugs. So
Okay.
definitely, injections have an upper hand when it comes to weight loss.
Okay. And so are these injections safe for patients to take on their own, or will they have to come see you every time they need an injection?
No, definitely these injections can be self-administered. It's only the first sitting that I would want to supervise or a medical expert supervision is needed. And subsequent injections, once we teach the patient, it's a very simple pen, quick pens are available nowadays. It's like an
Hmm.
insulin injection. So it can be administered safely by them, self-administered at home also. You
Hmm.
do not have to come and see me every time.
Okay. There's one another question coming up. How frequently is GLP-1 should it be administered? Daily or weekly?
So if we start off with the GLP-1 injections, for example, if I have to tell you about Mounjaro, it's a once a week injection. You have to pick up a particular day in the week where you don't tend to forget the injection dosing. And
Hmm.
if, for example, today is a Sunday, you start the injections on Sunday. Every Sundays, you get these injections, right?
Okay.
And at the end of every month, that is 4 weeks, we change the dosage. We increase the dosage as and when we get the
Hmm.
results.
Okay. Okay. And I have another question though. I'm sure a lot of people, really enjoy alcohol, and maybe that has, caused them to gain all the weight. So I'm
Right.
curious, do people who enjoy alcohol, can they enjoy a drink or two when they're on the treatment?
See, I definitely do not allow them to take alcohol. They have to abstain from alcohol when they're on these drugs because
Okay.
it can be a double-edged sword. It may
Hmm.
give them results, it may not give them results. In
Hmm.
fact, they may end up with a lot of side effects, worsening of side
Okay.
effects like
Okay.
vomiting, diarrhea. They may end up in a lot of complications. So, I definitely advise on abstinence from alcohol when they are on these
Hmm.
drugs.
Hmm.
And in the future, it is also going to suppress their craving for alcohol as
Oh,
an older.
so even after they're off the treatment, it will still suppress the craving, or
To some
while they're
extent
on?
for a short duration, but once you are off medicine or off alcohol, you don't feel like taking it the next time if there's a pretty
Ah.
stiff break, right?
Hmm.
So indirectly it
Hmm.
does affect the addiction and it has reduced and shown better effects.
Hmm. Okay. Okay, that's great. I'm also curious though, what age group is this uh, is this treatment good for? Like, is there a specific age? Do you need to be over 30, over 40 to be able to safely take it? What is the age group in?
Right. So GLP-1 drugs, the safest age group is above 18 years. And there is no upper limit. Yes, you can consider for every age group beyond 18 years, but definitely the newer drug that is doing rounds is Wegovy, which is another
Hmm.
drug in the market. Though it has been told in the US and abroad that you can try it in patients about 12 years of age, that is in teenagers. But back in India, we stick to the 18 years and above rule. And until
Hmm.
unless the teenagers genuinely require these drugs, we weigh the risk benefit ratio and then we decide whether they genuinely need the drug. Otherwise, 18 years and above is the safest age group.
Hmm. Okay, doctor, I think we'll be taking the last few questions. If anyone's got any questions, feel free to drop them in the chat. Just want to ask you again, why is Medfin's weight loss program a good choice for our attendees? And why should they come see you? And, what is the overall benefit they're going to get through this program?
So Medfin definitely has a lot of benefits. It has a doctor, a medical expert who's going to get in touch with you and going to guide you the right way of treatment, whether you genuinely need the drugs, whether there are other options open to you. There are frequent consultations, supervision by the Medfin team, where you will be each and every concern of yours will be addressed by them. And at the same time, the dietitian, the nutritionist will be there round the clock available for you. So definitely, Medfin is a good way to get your weight loss goals at the earliest. At the same time, it's going to make people more confident. It will increase trust towards better health. A lot of programs nowadays, which has not given results, but
Hmm.
this is a
Definitely.
scientific. It's a brand new drug, and it requires medical expertise to give the drug, and it's all scientifically proven. So it's an evidence-based medicine. So definitely,
Hmm.
medicine has an upper hand in this.
That sounds very reassuring. I think we have one really last great question. Someone says, can it be taken with other drugs like anti-cancer drugs?
See, malignancies, we have to be a little watchful, especially thyroid malignancies, and certain chemotherapy drugs do interfere with this drug. It depends on the drugs that they are taking if and the malignancy that they have. We do not want to give these medicines for people who have certain malignancies. Definitely, the medical details need to be mentioned.
Okay, so I think the best way to move forward with a healthy weight loss treatment is if you visit Dr. Afshan, if you speak with her, discuss your personal medical history. And just for everyone in the attendee, we want to let you know that we will be sharing a custom, a consultation link where they can book a consultation with Dr. Afshan. You can get all details you want. We'll drop it in the we'll drop the link in the live itself and also in the WhatsApp community. If there are any other questions, we'll take them now. Otherwise, we will let Doctor enjoy her Sunday. Is there anything else we should know, Dr. Mind? We've had a great, insightful conversation, but apart from this, is there anything on your mind that you think we might have missed?
I think we have covered everything more or less in a gist. I think everything that the major doubts revolve.
Hmm.
Definitely, one thing I would want to focus on is the pregnancy and the breastfeeding. Such
Okay.
individuals do not want to give this injection, but
Okay.
that doesn't mean that you cannot get pregnant because it has helped in fertility. So, once
Okay.
I give you a medicine, once a GLP-1 is started, you have to have at least 4 to 5 months period of GLP-1 drug so that you can conceive. So, at least 4 to 5 months free of GLP-1, and then you can definitely plan your conception again. So that is one
Okay.
important point where a lot of patients who want to conceive, they have been told first bring down your weight and then you plan on conception.
Handy. Hmm.
This is
Hmm.
one of the good ways to bring down weight, but make sure that the time is of essence. You have to make
Hmm.
sure you are not on this drug for at least 4 5 months.
Hmm. Okay, great. I think these are all the questions we can take as of now. Please don't forget to tune back to Medfin's page if you want to have a look at the recorded version of this live. If you have any questions, please feel free to reach out to us on WhatsApp via community. We will also be taking online consultations, and you will also get a custom link where you can book a free consultation with Dr. Afshan. Thank you so much, Doctor. This is a great, insightful, I think, session. I think all the questions we've had about this magic drug are cleared. And I think more than magic, I would like to conclude that it's more of a holistic treatment option than the magic that the media hype has been creating.
Definitely, definitely. Thank you, Sanya, for having me here. I hope I've cleared most of the doubts around
Yes,
this drug, and I
yes,
hope to see
definitely.
more patients who come and approach me for this drug. Definitely, we
Yes,
will have a weight loss journey together.
yes. Great. Thank you so much. Thank you for tuning in.
Thank you, Sanya. Bye.